Finding the diagnosis of thoracic outlet syndrome is very challenging because it's a diagnosis of exclusion. Historically, we've used tests where we actually take the patient's pulse, the Allen test, the Halsted test, the Adson maneuver. But what we know from research is the vast majority of people with thoracic outlet syndrome, 95%, have neurogenic pain. So as a consequence, we're kind of going away from all of those tests, and research has most recently shown that there are 2 tests that are very helpful to do to rule in thoracic outlet syndrome. And the first one is the Ruse test, or now it's called the elevated arm stress test, or the EAST test. That's the first test we'll do. So Megan, if you can bring your arms up like this and then open and close them for me. We're going to do this for 3 minutes, and we're going to look for recreation of your symptoms. So your symptoms would be probably along your ulnar nerve in digits 4 and 5. A positive test would be difficulty closing her hand. You might see the patient's elbow drop, or they might complain that this is recreation of their symptoms. You can rest. Ideally, you do this for 3 minutes. It's important to document the time because the patient may have a positive test, but when we initially start care, maybe it's positive at 20 seconds, and with a lot of care, now it's positive at 1.5 minutes. So those are the kind of things you're looking for. So that's the first test to help rule in thoracic outlet syndrome. The second test we're going to do for thoracic outlet syndrome is the upper limb tension test for the ulnar nerve. We're going to compare side to side to see where in the range of motion the patient's symptoms come on. So my patient has right-sided pain, so I've already looked at her left side. So I'm going to try and recreate her symptoms with an upper limb tension test of the ulnar nerve. So I'm going to place her in wrist extension and compress digits 4 and 5 to kind of preload the ulnar nerve. I'm going to depress her shoulder, flex her elbow, and then what I'm going to do is I'm going to abduct her arm. And when she says, oh, my symptoms come on, I'm going to let go of one of those ends. Did they go away? Mm-hmm. Okay. And are they back on? Mm-hmm. Can you very slightly tip your left ear to your left shoulder? Did those recreate your symptoms? Okay. So every time I load her ulnar nerve, I'm recreating her symptoms. How I would document a side-to-side difference is I would measure the amount of abduction she's at in her glenohumeral joint to show a side-to-side difference. She can improve and still have symptoms, but what will happen is she'll get farther in the range of motion when her symptoms come on. Okay, and so Megan, I know another thing, to kind of get your scalenes to calm down a little bit, we don't want you to be an upper respiratory breather. We want you to be a really good diaphragmatic breather. So with your hands here, your goal is to make this one expand without doing this upper chest breathing. And that way your scalenes will kind of calm down a little bit. So this is something you can do frequently throughout the day. We're doing it in sitting because you sit so much for work. So anytime taking a few breaths, 3 to 5 breaths, sprinkled throughout the day, probably a minimum of 5 to 6 times, would be ideal for you. So we know that the neurovascular bundle can get hung up in 3 anatomical areas: between the anterior middle scalene, between the clavicle and the first rib, and under the pectoralis minor. So as PTs, we do a deep dive into those areas to see if that is where part of the impairment lies. So in this case, what we found with Megan is she has tightness in her scalenes. So a way that she can stretch her scalenes at home is as follows. So Megan, I need you to make like a butterfly here and really anchor on your clavicle and first rib. So you're anchoring your scalenes. And then what you're going to do is you're going to side bend to the left. Very good. And then if you don't feel enough of a stretch, you're going to rotate to the right. I want you to feel a stretch through here. Yes? Okay. And I don't want to recreate her symptoms. I just want a low-grade stretch through this area. If this is not enough, she could go into extension to also get that scalene stretch. But I would have my patient do this frequently throughout the day. I say low and slow, so a low-grade, mild stretch to kind of increase that area there for her neurovascular bundle. So in order to mobilize your first rib, Megan, we found a little bit of elevation in your first rib. We're going to use this in the clinic, but at home you can use a yoga strap or a yoga belt. And I want it really close into your neck here to grab that first rib. Now what I want you to do is just very gently pull down on this, hold it for a few seconds, and then let it up. So that'll give you that gentle mobilization of that first rib, and that will also help make space for your neurovascular bundle. As you do this, like everything else, it should not recreate any of your symptoms into your arm. You can do this frequently throughout the day. So I know, Megan, that you do a lot of office work, and that's when your symptoms come on. And as you can see here, in this chair with your back pushed back, you're really slouched. And what we know is that that slouched posture where you kind of curve forward can really recreate your symptoms. So we're going to start with a lumbar roll. And I know it seems weird that I'm giving you something for your low back to fix pain up here, but you have to really have a good base so you can stack everything up appropriately. And instead of going out and buying an expensive roll, we're going to start with towels, because you can wrap them as tight as you want and you can get it as thick as you want to work for you. So what I'm going to do is I'm going to come behind you and I'm going to lean forward just a little bit. There we go. And now come back. And now try and slouch. It's harder, isn't it? So this will keep you in a better upright posture, and you can put this wherever you feel it works for you to kind of keep you in this upright posture. And that's an easy trick for you to do right now while you're doing your computer work to help with your thoracic outlet syndrome. Now, with your thoracic outlet syndrome and that posture, we talked about how important it is. You had mentioned that you have kids that play soccer and things like that, and there's no back support. So I made you this poor man's version of a Nada chair. So we took that lumbar roll, and what I did is I wrapped this kind of heavy TheraBand around it, and you attached it below your tibial tuberosity, and we basically made this kind of counter pressure system, so the bands actually pull you into that neutral spine. So this is something that a physical therapist can make very inexpensively, so when you go to those events and activities where you don't have back support, you can use this.